Our immune system is a powerful force, protecting us from infections and diseases, but sometimes this force can turn against us, causing more harm than good. Hemophagocytic lymphohistiocytosis, or HLH, is a rare disorder where the immune system goes into overdrive, leading to a dangerous state of excessive inflammation. This overreaction, often triggered by an infection or a weakened immune system, affects various organs, causing a wide range of symptoms. Imagine a small fire that, instead of being put out, spreads rapidly, engulfing everything in its path. That's what HLH is like, a runaway immune response that damages the body's own tissues and organs. This uncontrolled inflammation can be life-threatening if not diagnosed and treated promptly. HLH is a complex and serious condition, often requiring specialized care and treatment. Understanding HLH, its causes and its effects is crucial for timely diagnosis, effective management, and ultimately improving the lives of those affected by this rare and challenging disorder. To understand HLH, we must first understand how our immune system normally works. Picture your immune system as a well-trained army, always on alert, ready to defend the body against invaders like viruses and bacteria. This army consists of different types of cells, each with a specific role to play. Macrophages are like the frontline soldiers, engulfing and destroying pathogens. Natural killer cells act as special forces, eliminating infected cells. Cytotoxic T lymphocytes are like snipers, precisely targeting and killing specific enemy cells. In a healthy immune response, these cells work together in a coordinated manner, eliminating the threat and then standing down. However, in HLH, this delicate balance is disrupted. The immune army, instead of demobilizing after a battle, remains activated, leading to a continuous state of inflammation. Macrophages, the big eaters of the immune system, play a critical role in HLH. Normally, macrophages engulf and destroy pathogens, acting like Pac-Man clearing a maze. But in HLH, these macrophages become overactivated and start attacking healthy cells, causing widespread damage. This macrophage mayhem is a key feature of HLH. Instead of being controlled and eliminated after doing their job, these activated macrophages continue to proliferate and release inflammatory signals, further fueling the immune firestorm. Imagine a Pac-Man game where Pac-Man, instead of disappearing after eating all the dots, keeps growing larger and more aggressive, consuming everything in its path. That's what happens with macrophages in HLH. One of the hallmarks of HLH is hemophagocytosis, a phenomenon where activated macrophages start engulfing other blood cells, including red blood cells, white blood cells, and platelets. This cellular feeding frenzy further disrupts the delicate balance of the blood and contributes to the severity of HLH. Imagine a school of piranhas suddenly released into a peaceful pond, devouring everything in sight. That's similar to what happens during hemophagocytosis, where activated macrophages indiscriminately engulf healthy blood cells, leading to anemia, bleeding problems, and a weakened immune system. Hemophagocytosis is a diagnostic clue for HLH, often observed in bone marrow biopsies. This cellular chaos highlights the severity of the immune dysregulation in HLH and the need for prompt and aggressive treatment. Section 5, Cytokine storm, the body under siege. The overactivation of macrophages in HLH triggers a cascade of events, leading to a cytokine storm. Cytokines are signaling molecules that orchestrate the immune response. However, in HLH, the uncontrolled release of cytokines creates a dangerous inflammatory environment. Imagine a city under siege, with alarm bells ringing incessantly, causing panic and chaos. That's what a cytokine storm is like. A flood of inflammatory signals that overwhelms the body, leading to high fever, organ damage, and other serious complications. This cytokine storm is responsible for many of the life-threatening manifestations of HLH, affecting multiple organs, including the liver, spleen, brain, and bone marrow. Controlling this inflammatory cascade is crucial for improving outcomes in HLH. Section 6. Triggers of HLH igniting the firestorm. HLH can be triggered by various factors, including infections, genetic mutations, and immune system disorders. Infections, particularly with viruses like Epstein-Barr virus, are common triggers, pushing the immune system into overdrive. Genetic mutations can predispose individuals to HLH, disrupting the normal control mechanisms of the immune response. These mutations can be inherited or occur spontaneously, increasing the risk of developing HLH, often in infancy or early childhood. Other immune system disorders, like autoimmune diseases, can also trigger HLH. In these cases, the immune system mistakenly attacks the body's own tissues, leading to a similar inflammatory cascade as seen in HLH triggered by infections or genetic mutations. Section 7, HLH and other immune disorders, a unique challenge. HLH shares similarities with other immune disorders, like autoimmune diseases, but it also presents unique challenges. While autoimmune diseases involve the immune system attacking specific organs or tissues, HLH is characterized by a systemic overactivation of the immune system, affecting multiple organs simultaneously. This widespread inflammation makes HLH particularly dangerous, as it can rapidly escalate, leading to organ failure and other life-threatening complications. The diagnostic workup for HLH can also be challenging, as its symptoms often mimic other conditions, requiring a high index of suspicion and specialized testing. Understanding the nuances that distinguish HLH from other immune disorders is crucial for timely diagnosis and appropriate treatment. Early recognition and aggressive management are key to improving outcomes for individuals with HLH. Section 8. Living with HLH, a call for awareness and action. Living with HLH can be challenging, requiring ongoing medical care, frequent hospitalizations, and lifestyle modifications. Raising awareness about HLH is crucial for earlier diagnosis, timely treatment, and improved support for patients and families. Supporting research efforts to develop new and more effective treatments for HLH is essential. Clinical trials investigating novel therapies such as targeted immunotherapy and stem cell transplantation offer hope for better outcomes and a brighter future for those living with this rare and challenging disorder. Advocating for increased funding for HLH research, raising public awareness, and supporting patients and families are all vital steps in the fight against HLH. Together, we can make a difference in the lives of those affected by this devastating disease. Section 9, Research and Hope, the future of HLH treatment. The landscape of HLH treatment is constantly evolving, with ongoing research paving the way for more targeted and effective therapies. Clinical trials are exploring novel approaches, such as immunomodulatory drugs that dampen the overactive immune response, and stem cell transplantation, which replaces the faulty immune system with healthy cells. Gene therapy, a cutting-edge approach that aims to correct the underlying genetic defects contributing to HLH, holds tremendous promise for the future. By targeting the root cause of the disease, gene therapy has the potential to provide a cure for some forms of HLH. The dedication of researchers, clinicians, and patient advocates is driving progress in HLH treatment, offering hope for better outcomes, improved quality of life, and ultimately a future where HLH is no longer a life-threatening disease. Section 10, Conclusion, Understanding HLH, Empowering Patients. HLH is a rare and complex immune disorder that can be challenging to diagnose and treat. However, with increased awareness, timely diagnosis, and appropriate management, outcomes for individuals with HLH can be significantly improved. Understanding the underlying mechanisms of HLH, the role of the immune system, and the importance of early intervention is crucial for both healthcare professionals and the public. Empowering patients and families with knowledge about HLH, its symptoms, and available treatment options is essential for improving their journey and advocating for their needs. As we continue to learn more about HLH, we move closer to a future where this rare disease is no longer a life-limiting condition. Through research, collaboration, and unwavering support, we can make a difference in the lives of those affected by HLH.